Good morning, dear colleagues. Today's theme is subclavian artery, the common carotid artery, external carotid artery, and internal carotid artery. So we can summarize that we shall discuss today this theme according the vessels of head and neck. So I'd like you remember the main structures of magistral vessels, which are branches of arcus aortae. So you can see that arcus aortae here and three main arteries begins from it, originates from it. They are right subclavian artery, here it is. Truncus brachiocephalicus, here it is, which then will be divided into right subclavial artery and common right carotid artery. The second artery is left common carotid artery, and third is left subclavian artery. So from arcus aorta we can see three large arterial vessels. Then, now let's begin from the subclavian artery. You can see that it has three segments. It's mistake, segments, and 5 branches. So here it is, two main photos from the atlases, anatomical atlases, and the subclavian artery, here it is. So we can see that it is also like arch which surround first rib, and there are 3 segments. First segment is here. So from the origination of subclavian artery up to entry into spatium interscalenum. I hope you recognize that this is musculus scalenus anterior. So in this small region we can't see subclavian artery because it is in second segment. So first segment is here. And what vessels we can find in first segment of subclavian artery? First of all, arteria vertebralis. It is designated by number 1 here, so we can see that it is directed upward into the direction of head. So arteria vertebralis. Here on the right picture we can distinguish that this vessel has this specific name because of it passes through canal in transverse process of cervical vertebrae, but not from all 7. This 7th cervical vertebrae is free from this vessel, but usually from the 6th, sometimes from 5th. So arteria vertebralis elevates to the sixth or fifth transversal process of cervical vertebrae, enters it and then passes inside of this canal, inside of processus transversus, and we can remember that features of cervical vertebrae is connected with this peculiarity that inside of each transversal process we can find in cervical vertebrae foramen transversum, especially for arteria vertebralis. Then next number 2 vessel is arteria thoracica interna. Arteria thoracica interna is designated by number 2. You can see that it is directed downward in the mediastinum. So if we try compare arteria vertebralis and arteria thoracica interna, they originates in the same level, but arteria vertebralis is directed upward and arteria thoracica interna is directed downward, so in opposite sides. And then number 3, this vessel, very short, so I again cleaned this designation number 3, and you can see that is so short that don't more than 1 centimeters, very often less than 1 centimeters, and the designation is number 3, truncus cervicalis, number 3. And this truncus cervicalis, it is divided into 3 and sometimes 4 vessels, and they are arteria thyroide inferior, 3A. This is arteria thyroide inferior. Arteria cervicalis ascendens and arteria suprascapularis, cervicalis ascendens and suprascapularis, 3B, here it is, and 3C, arteria cervicalis superficialis. So you can find here 4 vessels, but I designated only 3. Why? There are 2 reasons. First of all, each of us are not similar to another person. So we all have some features, some details, especially according to the vessels. Vessels are very variable in different persons, and that's why in some situation during the preparation we can find 3 vessels, in another situation we can find 4 vessels. And another reason is that during the this according to different textbooks, we can find also different information according to these vessels. Sometimes you can find 4 vessels, usually in American and European textbooks, and more often we can find in Russian textbooks 3 vessels. One of the reasons of such differentiation is also the geographical and national peculiarities of variability of arteries. So, truncus tira cervicalis and 3 its branches. That was the first segment. And now, second segment, truncus costo cervicalis. In second segment, we can find only one vessel, truncus costa cervicalis. And here, in this picture, we can't find it. Why? Because it is located posteriorly, according to this muscle, musculus scallianus anterior. That's why we can't see this this vessel. But in right picture, we can find these 2 small vessels, 4A and 4B. 4A is arteria cervicalis profunda and 4B is arteria intercostalis suprema. So truncus costa cervicalis is also quite short, and then it is divided into 2 different vessels, arteria cervicalis profunda 4A and arteria intercostalis suprema 4B. Unfortunately, usually it's quite difficult to demonstrate all these vessels in the specimen. Why? Because, first of all, they are quite deep situated, and second, that we ought to prepare either arteries, either nerves, and together usually it isn't easy to prepare such kind of specimen. That's why we shall search most of these vessels in the atlases, in textbooks, and my aim was to prepare all necessary illustrations, the photos from the famous textbooks and atlases, and so you can use these pictures during your preparation to the today's theme and during preparation to the exams. And now third segment. Third segment is those part of the artery which is laterally to the musculus scallianus anterior and spatium interscallianum. So this part, and it's quite also short part, and usually have 1 or 2 vessels. Arteria transversa colli, number arteria transversa colli and arteria dorsalis scapulae, number 5. Excuse me. Arteria dorsalis scapulae, number 5. Again, these vessels are very variable. That's why they can seriously differ in different persons. Arteria dorsalis scapulae, here it is. We can't find in this picture arteria transversa colli. Why? Because it isn't drawn here the plexus brachialis, brachial plexus, and plexus cervicalis, cervical plexus, and one of the peculiarity of transversa coli, arteria transversa coli, is that it passes through these plexuses. So if plexus isn't demonstrated, that's why it's difficult to demonstrate also arteria transversa coli themselves. So now we finished arteria subclavia, and next serious part of today's theme is the carotid arteries. Carotid arteries, they could be demonstrated in this picture, for example. First of all, I'd like to remember you the muscle number 1, musculus sternocleidomastoidus, and it's easy to see that number 2, arteria carotis communis, that means common carotid artery, it takes place posteriorly to this muscle. So it is hidden posteriorly to musculus sternocleidomastoidus. And then in trigonum caroticum, it will divide into two main vessels in arteria carotis externa, here it is, and arteria carotis interna, here it is. And now each of these vessels. Let's begin from external carotid artery, arteria carotis externa, arteria carotis externa. Here it is, three-dimensional reconstruction of arteria carotis externa et interna in angiography mode using computed tomography. Very detailed information. Do you agree? So this is arteria carotis communis, sinistra, sure, and this is arteria carotis externa, and this is arteria carotis interna. It's very interestingly that in this region, this is trigonum caroticum. These two vessels are situated quite strangely according to the name. For example, here it is more medially and more anteriorly located. It's arteria carotis externa. We say arteria carotis externa. It means that it should be placed laterally, but not. It's placed medially. Arteria carotis externa is here. It's placed medially. And arteria carotis interna, it's placed laterally and externally and posteriorly to the arteria carotis externa. So this is the main vessels, and each of them has their own detailed structure, and we shall find them. Now I'd like to demonstrate you in our specimen these main vessels. Here it is. arteria carotis communis, common carotid artery. And here it is bifurcated into two large vessels, into arteria carotis externa and interna. What is this level? This level of bifurcation is coincide with oschioidum, hyoid bone. So at the level of hyoid bone, we can find the bifurcation of common carotid artery. And then there is a question. What is it? Is it internal carotid artery or external? And what is this? Is it internal or external? So we should remember that external carotid artery here is located medially and anteriorly. Here it is arteria carotis externa, and here it is arteria carotis interna. This is a rule. In this place, this is trigonum caroticum. Do you remember the topography of the neck? In trigonum caroticum, arteria carotis interna is laterally and posteriorly according to arteria carotis externa. Here it is, arteria carotis externa. So, return to our presentation, and we shall begin from external carotid artery. I use this picture from Gray's Anatomy, Grant Anatomy, a very famous textbook, and it's convenient here to demonstrate that all branches of external carotid artery, first of all, they supplies by the blood external tissues of the head, that means soft tissue of the head, and the second very important information that there are about 9 branches of external carotid arteries, and they could be divided into 3 groups. First group is anterior group, and each of groups, it's convenient for remembering, each of groups consist of 3 vessels. Number 1, here in parentheses. Why in parentheses? Because in this picture it isn't demonstrated. Arteria thyroides superior. Why it isn't demonstrated? Because thyroid gland is lower than this picture. It will be located on the neck, and we use in this picture only skeleton of the head. So, arteria thyroides superior. Then, number 2, arteria lingualis. Here it is. So, anterior group has branches which are directed surely anteriorly. Here it is, arteria lingualis. The name explains the place of supplying. Tongue will be supplied by this artery, arteria lingualis. And number 3 is arteria facialis. It's a very interesting direction. You can see that, first of all, it directed anteriorly, and this small part is located posteriorly to the mandible, and then here at the level of middle of the corpus mandible, this artery cross the margin of the corpus mandibulae, and in this place, try palpate this place in your face. You can find a pulse. You can find that pulsation of this artery could be felt because we push it to the bone. So this place is place of palpation of pulse of arteria facialis. So I going to demonstrate it in our specimen. I shall use this specimen, and arteria facialis, here it is. Here it is. I said you that it could be palpated in this region. Please try to palpate it here, and you can find a pulse beating. And then we should know that arteria facialis elevates to the angle of the eye, and also have some small branches to the upper lip and lower lip, to the nasolabial fold, and to the medial part of the eye. And in another specimen, I would like to demonstrate the same. Here it is, arteria facialis. Here it is, and it elevates to the medial angle of the eye and takes some branches for upper lip, for lower lip, and to the nasolabial fold. Thank you. We shall return to our presentation. And now, when we finished the anterior group, next group is middle group. Middle group also consists of 3 vessels, and first of them, number 4 in parentheses here, arteria pharyngeal ascendens. Why in parentheses? Because it isn't demonstrated in this picture. And why it isn't demonstrated? Because it originates very lowly, low than this picture can show us. At the neck, it's the place of bifurcation of arteria carotis externa and interna. So we know that there is such kind of vessel, arteria pharyngeal ascendens, but in this picture it isn't demonstrated. And next, arteria maxillaris, number 5, arteria maxillaris. Here it is. How can we explain the location of arteria maxillaris? Arteria maxillaris is located posteriorly, or we can say medially, to the condylar process of the mandible. So it surrounds from medial side condylar process of mandible. Arteria maxillaris. it's quite complicated vessel, and then we shall try to find it in scheme in a special place of this presentation. And number 6, third vessel from middle group, arteria temporalis superficialis. So we can find that arteria temporalis superficialis is the most last artery from arteria carotis externa, and also we can say that here it is arteria carotis externa. Then number 6, arteria temporalis superficialis, is prolongation of arteria carotis externa on the temporal bone. So here it is arteria temporalis superficialis. And now I'd like to demonstrate these vessels in our specimen. First of all, here it's arteria temporalis superficialis. Arteria temporalis superficialis. And according to the arteria maxillaris, sure, it isn't possible, it's impossible to demonstrate in this specimen, but here we can find it. What is features of this specimen? All the soft tissues were removed, and these deep located vessels were opened. So here it is, arteria temporalis superficialis as prolongation of arteria carotis externa. Here it is carotis externa, and here it is arteria temporalis superficialis. They are prolongation of each other, and this is arteria maxillaris. So we can say that arteria temporalis superficialis and arteria maxillaris, they are located perpendicular to each other. That means that arteria maxillaris originates from arteria carotis externa moving anteriorly, and arteria temporalis superficialis originates and moves superiorly. That's why between them there are right angle. And return to our presentation. So we have 3 vessels in anterior group, we have 3 vessels in middle group, and also we have 3 vessels in posterior group. So they are number 7, here it is, number 7, located and directed posteriorly. This is arteria auricularis posterior. Number 7 is arteria auricularis posterior. Then number 8, arteria occipitalis, and number 9, again in parenthesis, arteria sternocleidomastoideo. Why in parenthesis? Because it isn't seen in this picture, because it isn't seen musculus sternocleidomastoidus, it was removed, and that's why arteria also isn't demonstrated. So you can see, very convenient for remembering, 9 vessels, 9 branches of external carotid arteries, and 3 in anterior group, 3 in middle group, and 3 in posterior group. According to posterior group, I'd like to demonstrate you, first of all, arteria accipitalis. You can ask me, but arteria arteria carotis externa is projected here, and arteria accipitalis 10 centimeters to the back. How it could be? Because you remember, this is the skull, and this is sulcus arteriae occipitalis. This is sulcus arteriae occipitalis, close to the incisura digastrica. So sulcus arteriae occipitalis is place where occipital artery passes posteriorly and between soft tissue, between muscles of the occipital vertebral groups, and then it should reach this place. So again, I use another specimen, arteria occipitalis here, and it originates, here it is, quite small vessel, but it passes 10 or 12 centimeters in posterior direction, and then we can find it here on the occiput. And you also can try palpate it here. It's possible to find pulse beating in this place to distinguish this vessel. According to arteria auricularis posterior, it's extremely small. It's quite difficult to demonstrate it here, but we shall try to use for this aim the special picture. And now branches of external carotid artery and arteria maxillaris. So arteria maxillaris, it's photo from very famous and very good textbook of Lippert in German language, but they use Latin, so it's easy for international purposes. I don't want to demonstrate each vessel here. I'd like to propose you make a pause when you shall watch this video, and then to try find each of designation, number 1, number 2, number 3, and so on. And just now I'd like to demonstrate only arteria carotis externa. Here it is, number 12, arteria carotis externa. Here it is, number 12. which prolongates to number 1, arteria temporalis superficialis. So it's easy to find that arteria temporalis superficialis is direct prolongation of artery carotis externa. And here, in the right angle to it, we can find arteria maxillaris and numerous branches of it. These branches quite difficult to find in specimen, but we should know them, and so let's try to draw ourselves this picture. So number 1 is arteria carotis externa, and perpendicularly to it, number 2 is arteria maxillaris. You can see that I use here 3 different attenuations, 3 difficult tunes of the red color, for we can distinguish 3 different sections of arteria maxillaris. So there is first section, which is designated with light red color. This first section curves around the neck of mandible, and second section, which is inside of fossa infratemporalis. I'd like remember you where is fossa temporalis located. This is lateral aspect of the skull, and fossa infratemporalis, here it is. This is fossa temporalis, and this is fossa infratemporalis. Fossa temporalis and fossa infratemporalis are connected to each other, and border between them is this zygomatic arch. So this is fossa temporalis and fossa infratemporalis. Second section is inside of fossa infratemporalis, and third section will be more deeply. I'd like to demonstrate it here. More deeply here. What is it? It is fossa pterygopalatina. Fossa pterygopalatina. And now I try to demonstrate this in our plastinate specimen. And here it is, arteria maxillaris. Sure that this place is second section, and third section is inside of fossa pterygopalatinum, so it's impossible to demonstrate it's deeply. And this is fossa mandibularis, so here was the neck of the mandible, and this is the first section. So this is the first section, this one. This is the second section, this one. And third section is deeply in fossa pterygopalatinum. So we shall return to our presentation, and now I shall draw the mandible, and number 2 is seen that is a section around the neck of the mandible, so it's first section. And then these more yellow color, it's second section, and this third section in fossa pteriga palatina is more deep, more difficult for demonstration. And now to distinguish all the details, number 3, this is arteria temporalis superficialis. So again, arteria temporalis superficialis and arteria carotis externa are prolongation of each other. And arteria maxillaris is according to perpendicular angle, right angle to the carotid external artery. And now the most last branches of arteria maxillaris, number 4. What is it? Number 4. Arteria infraorbitalis. I use here this small circle for demonstrate foramen infraorbitalis. And sure, through it, arteria infraorbitalis passes. Let's try to find it in our specimens. Here it is the skull, and here it is foramen infraorbitalis. You remember that here nervus infraorbitalis passes, and also together with it arteria infraorbitalis, which is the last branch of arteria maxillaris. It's good possibility to declare that practically always arteries not passes alone. Usually, together with arteries, we can find a nerve and we can find veins. So there is vessel and nerve bundle. So here, vessel and nerve bundle contains arteria infraorbitalis and nervus infraorbitalis. And again, this place you can easily to palpate, because nervus infraorbitalis is quite painful when you palpate it, and sometimes you can find here the pulse beat because artery is pulsates. And now I'd like to try find this artery. Here it is. Here it is. Here it is, the pes anserinum minus of nervus infraorbitalis from trigeminal nerve, and together with it we can find a small branches of artery. What is it? It's arteria infraorbitalis, the last vessel from arteria maxillaris. Okay, let's return to our presentation. And then next vessel is in first section number 5. What is it? Number 5 is it's arteria auricularis profunda. It's arteria auricularis profunda, which passes inside to the temporal bone. And then number 6, parallel to it, number 6 is arteria tympanica anterior. It also passes inside temporal bone. So these two vessels are neighboring to each other and quite small vessels. It's quite difficult to demonstrate on the specimen. And then enough large vessel, number 7, it's arteria meningea media. Arteria meningea media. And the branches of it, arteria tympanica superior, number 8, which also passes inside of temporal bone, and quite large and serious vessel number 9, it's arteria alveolaris inferior. Arteria alveolaris inferior. And now let's try to find them in specimen. First of all, I'd like to demonstrate to you the this bone. I hope you can distinguish that it's sphenoidal bone, and this small foramen is foramen spinosum. Foramen spinosum, close to foramen ovale, laterally to foramen ovale. This is foramen ovale and this is foramen spinosum. And now I use the natural specimen, and again foramen ovale and foramen spinosum. Through it, through foramen spinosum, arteria meningea media enters cerebral cavity, and then we can find here the footprints of it, which named sulcus arteria meningea media. Here it is, number 80. Sulcus arteria meningea media. Here it is. So arteria enters the cerebral cavity and then passes on the internal surface of temporal bone, and that's why we can find footprints of it on the cerebral surface of temporal bone. And the same in a real plastinate specimen. Here it is, arteria meningea media. Arteria meningea media. Here it is. Arteria meningea media. And also I'd like to demonstrate here this vessel. What is it? What is it? It's vessel which enters canalis of mandible. So it enters inside of the mandible, so it passes in this canal together with nervus alveolaris inferior, and they have the same name, number 9 in our picture, that was arteria alveolaris inferior. Arteria alveolaris inferior. So now we shall return to our presentation, and number 9, arteria alveolaris inferior, and number 10, arteria milohyoida. From arteria alveolaris inferior, arteria milohyoida to with the same name muscle it passes. And also we can find arteria mentalis, number 11. Again, you can try to palpate it, pulse beat in this region, in the chin. So arteria mentalis, number 11, it passes through foramen mentalis into anterior surface of the chin, together with the same name nerve, nervus mentalis, which is branch of the nervus alveolaris inferior. And now, number 12, I try to demonstrate rami dentalis to the teeth for blood supply of each teeth. I don't know, are you acquainted it with situation of delivering eliminated of teeth? So if surgical operation of tooth removing have place, so very often there is a bleeding from the alveoli due to damaging of these small vessels. That's why it's necessary to make tamponade, to make tampon inside of the alveolar after dent removal. And now we have finished the second section, we have finished the first section, and now the second section, number 13, arteria temporalis profunda. Number 13, arteria temporalis profunda. These vessels make blood supply to the showing muscles, especially to the musculus temporalis. So if arteria temporalis superficialis supplies skin and soft tissues under the skin, arteria temporalis profunda, number 13, they supplies the musculus temporalis. So it's different aim. And also with analogous aim, there is arteria masseterica to blood supply of musculus masseter. So we can say that second section of arteria maxillaris is necessary for blood supply of shoving muscle, musculi masticatorius, for musculi masticatoria. And also number 15, rami pterigoidei. There are several, and also they serve for blood supply of musculi pterigoidus lateralis and medialis. So practically all the aim of second section is for supplying of the shoving muscles. So I demonstrate you that all these vessels, temporalis profunde, masseterice, rami pterigoide, they are branches of shoving muscles. And now number 16, very small vessel, arteria buccalis, for blood supply of bucca. Arteria buccalis. It's muscle of facial expression, not shoving muscle, but they originate in the same second section. And now the third section inside of fossa pterygopalatina. I'd like to remember you that fossa pterygopalatina is a place, we can say that it's a place of strategic purpose in the skull. So from this small, about 1 cubic centimeters place, it's possible to enter to nasal cavity, to oral cavity, to orbit, so and in cerebral cavity. So it is really strategic place inside of the skull, and that's why we shall use here by the branches of third section 1 foramen, 1 fissure, and 1 canalis. So 1 canal, 1 fissure, and 1 foramen. Number 17 is arteria sphenopalatine. You remember that from fossa pterygopalatina is possible to enter nasal cavity by means of arteria sphenopalatine. I'd like to demonstrate to you this in this sagittally cutted skull, and from here fossa pterygopalatina, and now through it passes foramen sphenopalatine. That means through this foramen sphenopalatine, arteria sphenopalatine enters the nasal cavity and supplies the mucus of nasal cavity. And now we shall return to our presentation. Number 18 It's arteria palatina descendens. You can see that it passes downward through the special canal, Canalis palatinus major. Canalis palatinus major, let's return, is here. So if I enters through this canal, we can reach the pterygopalatine fossa, and it means that this vessel, arteria palatina descendens, will supply the hard palate and soft palate. That means upper wall of the oral cavity. So you can see on this picture, let's return to it, that the vessels of third section pass through one foramen, number 17 foramen sphenopalatinum, one canalis, number 18 arteria palatina descendens through canalis palatinus major, and one fissure, number 4 is arteria infraorbitalis. To pass there, to enter there, it's necessary to use fissura orbitalis inferior, through which the main part of third section passes. And again, I'd like to say about one interesting vessel, which is between the third and second section, here number 21, arteria alveolaris superior posterior. It is designated as part of second section, but really it is on the border between sections. Arteria alveolaris superior posterior serves to blood supply of the upper teeth, and so we can understand that practically all the structures for process of the chewing is used by branches of arteria maxillaris. So arteria maxillaris serves not only for blood supply of maxilla, but also mandible. And main aim of this vessel is aim to supply with the blood the chewing apparatus as muscles and teeth and mucus. Now, Before finishing today's lecture, I'd like to summarize that one of problems of today's theme is that impossible to demonstrate very small branches of arteries, but we should know to them. That's why we shall use the tests using these pictures for understanding the details. And I'd like to declare that last week on our scientific council, it was decided that before you finish an exam, all of you shall pass through a special test, and we shall use such kind of pictures in this test. So I wish you to good results in your preparing. Thank you.